Member for Melton.
Speaker, and I rise today to contribute to the matter of public importance listed by the member for Gembrook, and interested to hear his contribution. And I just want to pick up on a couple of things that he raised and respond to them. And in particular, he's saying that there's been no response from the minister. Well, of course, in last year's state budget, there was a delivery of $46.14 million for 43 additional staff who are in place now at Esther, and it goes a long way to address the issues. But again, people have to be trained, they have to gain experience to be proficient call takers and dispatchers. But of course, in the last week, there's been a further announcement by the minister of a $116 million injection for an additional 120 staff, again to be trained and to gain experience and be proficient call takers and dispatchers. You said you wanted to hear the contribution, so maybe you should shut up and hear it.
Order. Through the chair.
And the minister stated the other day, the health minister stated the other day in this chamber that there is more to be done. So anyway, Speaker, I had to check the date when I saw this MPI listed on the notice papers, and I was wondering whether it was Groundhog Day. Those opposite want to have a discussion.
Just ask the member for Melton to resume his seat. All right. So this is a passionate debate about an issue that people are very passionate about. The member for Gembrook was heard in relative silence with a few interjections. The member for Melton should be also heard in relative silence with a few interjections. I ask members at the table not to interject. The member for Melton has the call.
Thank you, Speaker. Initially, what I will do is I will refer to some history, and you mentioned the Kennett era, and that's okay. We're still, patching up the damage from that era. Look, I remember the Kennett era very well. I worked as a paramedic. I also worked at the union. I went to the union during that issue, and during that Kennett era, there were massive cuts in healthcare and ambulance services, and there was also many deaths because of what they introduced during that era, and that was the privatisation of the communications centre to Intergraph. They privatised the workshops, they privatised the stores. They had an agenda to privatise ambulance stations, and they actually did privatise an ambulance station, and I see the member for Cranbourne here, and we raised that when I was out at Cranbourne about a year ago with the member about the Cranbourne Ambulance station being privatised. And what the agenda was to have ambulance franchises around the metropolitan area of Melbourne. And if you couldn't afford the response of ambulance services, you wouldn't get the service. So that was the agenda back in the 90s. The damage that did took many, many years to be repaired. And as I say, Kennett was successful in privatising the Cranbourne Ambulance branch and Cranbourne Ambulance service for 10 years. And now, I'm pleased to say, under this government, under a Labor government, it's been brought back into public hands. And I have to say that if the Bracks government had not been elected in '99, we would have had ambulance branch franchises all over metropolitan Melbourne, and that would have been disastrous for Victorians. So imagine the cost to Victorians' quality of life and lives themselves if Kennett had been able to monetise casualties and Victorians' health emergencies. We know the effects of how ambulance response times and service can be destroyed thanks to the Baillieu-Napthine government and their experiment of their war against paramedics in 2010 to 14. And I was in the middle of that war as the Secretary of the Ambulance Union. That went on for 3 years, where we were having negotiations with that government at the time. And unfortunately, through that negotiation, we see a situation where paramedics were fed up with that government and had to take it into their own hands to publicise the concerns on the windows of ambulances. And I have to remind our opponents across the chamber that that is why you're sitting over there, is because your war against paramedics back in the term of 2010-2014. And I'll continue to remind you of that. The other thing that Kennett did do back in his era was to privatise the non-emergency patient transport sector. And this sector, Ambulance Victoria used to do all non-emergency transport, and they could have surge capacity with those non-emergency cars to come back and pick up the emergency work when there was a surge. Right now, we do rely on some of the private companies to help Ambulance Victoria, but they are not paramedics, they're ambulance attendants and they're patient transport officers, so it's still not to the same degree. So we don't have that reliance on those crews, those patient transport crews, even though they do a high percentage of work, they can't deliver the same level of care that ambulance paramedics can. So look, in 1995, which is a long time ago, I went from being a paramedic into the union. And I was the Assistant Secretary initially and then became the Secretary for 13 years during the 2000 era. I want to thank Jeff Kennett for one achievement, and that was he politicised ambulance paramedics. And I think it was a great thing that he did. And because of that, it's cost 2 coalition governments their term. And I'll remind you when. 99, see you later, Jeffrey. 2014, see you later, Dennis. Right? Because of their actions against paramedics and other healthcare workers at the time. So they started to learn and campaign, and I thought it was a fantastic thing. And yes, they'll continue to campaign regardless of the colours of government, and that's why someone like Danny Hill would be making comments. Danny Hill's doing that on behalf of his members, but he's also doing it on behalf of Victorians. It's not just about benefits for his members, it's about benefits for Victorians. And all healthcare workers will fight to improve the system, regardless. It's never perfect, but you continue to fight to improve the system as much as you possibly can. So, as I said, at 2014, paramedics were politicised and they took the fight up to government, hence you're in opposition now. So 22 years on from Kennett, the clear message learnt is that you need to work with Victorians, and in particular the public sector workers like paramedics, like nurses, like healthcare professionals, like the call takers and dispatchers, because if you don't, you suffer at the ballot box. The Andrews Labor government is getting on with getting things done and was further endorsed by the outcome of the 2018 election. And since the Andrews government has been elected, we've seen our paramedics supported with better wages, better conditions and, of course, better mental health support. No, it's not all about elections for me. No. There's been vast improvement in paramedic numbers. New ambulance branches, built and upgrades of older branches. There's been comments made in other contributions that we've done nothing. We have done a hell of a lot. 700 more paramedics in the last year. New ambulance branches dotted across the state.
Member for Evelyn's already been warned.
Upgrading of staffing numbers in rural and regional areas. Double crewing in country towns where we used to only have single officer crewing for paramedics in small country towns. Now it's dual officer crewing that doesn't have a greater reliance on using volunteers within the community to respond to cases. There's been a little thing called COVID around of recent times, and of course we need to understand the effect of COVID on all of our services, in particular our health services, and also what's happened at Esther. And we've seen, I think in the last quarter, a 19% increase in calls that have gone, or cases that Ambulance Victoria have responded to. Well, 19% increase in the Melton electorate alone. I know in Ambulance Victoria, 16.2% increase in cases that they've responded to, and the busiest time that they've had of in excess of 91,000 Code 1 cases. And of course, when you get such an increase in calls and cases, there's also other factors that extend the period in regard to availability or unavailability of ambulances. And that is that because of COVID and because of the need to wear PPE, because of the need to protect the patients, because of the need to protect the healthcare staff at the hospitals, it takes longer to do a case, to respond to a case, to attend a case, to transport the patient, to offload the patient at the hospital. It takes longer. So normally, on average, if you had a case time of an hour and a half, it is probably blown out to at least an average of 3 hours before that ambulance crew can be released to another case. And when you've got a 16 to 19% increase in caseload, that is a massive blowout in times. Now you might say, well, that can be fixed overnight. It is physically impossible to fix it overnight. It takes 3 years to train up a paramedic. It takes a further 12 months to get workplace experience before they are deemed to be qualified and before they're able to run out there as a proficient paramedic being able to respond to any type of case. Likewise, call takers and dispatchers at Esther. it takes them 6 months training and then experience on top of that to become a proficient call taker and dispatcher. And let me say, those call takers and dispatchers are working as hard as they possibly can. And there's been reference made in this chamber about how they've worked excessive overtime, how they've had to take other days off just to have a rest. That happens right through the health sector. That happens right through the call taking and dispatch system. And that reliance on the staff is not new. It is not new. And it won't, regardless of the numbers that you bring in, it won't be new into the future either. There'll be a reliance on staff to make themselves available to come in and fill vacant shifts. And those shifts become vacant for a whole range of different reasons. At the moment, due to COVID, there has been some furloughing of staff, both in the ambulance service and also at ESTA, and it has caused, obviously, major problems for them. So, of course, at the peak of the Delta and Omicron wave, the busiest in ESTA's history saw an average of nearly 4,000 calls per day. And look, when I left the industry only 3.5 years ago, if they were doing 2,000 calls per day, it was a massive workload back then. So we're talking double that in 3.5 years. It is enormous. And that increase, you will find, has been due in the last 2 years to COVID. There's no questions about that. They work in a situation at ESTA, they work almost like an office space, even though it's quite a big room. And of course, I raised before the issue of vacancies in regard to staff, and that's due to the COVID situation again and a number of their staff being furloughed. As I said earlier, there has been an injection of funds out of the state budget to increase their numbers by 43. Those people have been trained and put in place now. That will help initially, and as I said, further injection of $116 million to introduce a further 120 staff. And of course, that funding for the 120 staff will be for new ongoing positions. Of course, and that also, that injection of funds builds on $27.5 million allocated in October for ESTA to address call-taking demand pressures and implement a scale-up technology solution. So there's no doubt there's some issues in regard to the technology, and obviously some of that funding will go towards improving that situations. Again, I've got to reiterate the pressures that the call-takers and dispatchers are under. And I'm not sure whether people are aware of the process in regard to how all this works when someone rings 000. But someone will have an incident, they'll pick up the phone, they'll dial 000. They don't talk to ESTA straight away, they talk to Telstra. And that could be a Telstra operator anywhere in the country. They will patch, they'll ask, which service do you require? Police, ambulance, fire, and they'll patch them through. It will then go through to ESTA for a call taker to pick up that call. Once that call is picked up, they will get the details of the incident, and then it will be referred off to a dispatcher to dispatch the case to the ambulance service, to the next closest available ambulance crew. But also within that room, Ambulance Victoria have staff that oversee the clinical status of patients. They have staff like duty managers that oversee the resourcing levels of the ambulance service, and they can make decisions to bring on additional resources. They, as I say, they have clinicians, they have support staff. These are all people put in place, highly trained paramedics put in place to try and protect Victorians through the systemic processes. And there's also a secondary triage where people ring up 000, try and get an ambulance because they think they'll be attended to straight away, but they don't require an ambulance, and the secondary triage will question them about their condition and get more information, and they may refer them off to a locum, a GP, wait to see the doctor tomorrow. Yes, they may organise a taxi for them because they don't require an ambulance. 25% of calls into the comm centre do not require an emergency ambulance. Now, if we're sending out messages that anyone that rings 000 should get an ambulance, it's the wrong message that we're sending. People that are under emergencies should call 000. People that are not under an emergency shouldn't be ringing up to gather information from the call takers or dispatchers. As I say, I want to thank our paramedics, I want to thank our healthcare workers, I want to thank the call takers and dispatchers for the wonderful job that they've done to try and keep the system going, to attend to Victorians Yes, there's always going to be some issues and cases that will be highlighted. No one wants to see that. We're all trying to improve the system. There's been an injection of funds. There'll be more staff, and there's more to be done.
Member for Lowen.